In this video, I'm going to talk about the best birth control options for breastfeeding moms. There are a lot of different choices out there, so I want to make sure you have all the information you need to make the best decision for you and your family. 1. What are the most effective types of birth control for breastfeeding mothers? The most effective types of birth control for breastfeeding mothers include non-hormonal options, such as barrier methods diaphragm, cervical cap, the non-hormonal IUD, and male and female sterilization procedures. Hormonal options such as hormonal IUDs, progestin-only pills, contraceptive injections, and contraceptive implants may also be effective, but some studies suggest that these methods may reduce breast milk supply. Talk to your doctor about the best options for you. 2. How long after giving birth should breastfeeding mothers wait before using birth control? It's recommended that breastfeeding mothers wait at least 6 weeks after giving birth before using any form of hormonal birth control. This gives the mother time to establish a good milk supply and may help prevent any negative impacts from hormones on her body. During this waiting period, other non-hormonal methods of contraception should be considered by both mom and baby's father. These methods can include male or female condoms, diaphragms, spermicides, and more. It's important to note that if the mother is breastfeeding exclusively and not giving any formula to the baby, her body may not be able to produce enough hormones for contraceptive methods to be effective. This includes oral contraceptives and hormonal intrauterine devices IUDs. If this is the case, then non-hormonal methods should be used until the baby is receiving additional sources of nutrition. 3. What birth control methods are safe for breastfeeding mothers and their infants? It is important to note that no birth control method is 100% effective, but some are more reliable than others. Here are the best birth control options for breastfeeding mothers and their infants. Contraceptive injections. These injections contain hormones like progestin, which act as long-term contraceptives. While this option is safe for breastfeeding mothers, it can reduce the amount of milk produced, and it is not recommended for mothers who are planning to breastfeed for longer than 1 year. Condoms. This barrier method is also a reliable choice as far as contraception goes. However, they do need to be used each time to be effective. IUDs. An intrauterine device is a small T-shaped device that can be inserted by a healthcare provider and offer long-term protection from pregnancy. They are safe for breastfeeding mothers, however, they do need to be monitored regularly. Diaphragm. This barrier method also needs to be used each time and needs to be inserted by a healthcare provider. 4. How can breastfeeding mothers monitor their fertility to determine the most effective birth control method? Monitoring fertility is an important step for breastfeeding moms who want to find the most effective birth control option. Breastfeeding mothers can use various methods to track their ovulation, such as charting their basal body temperature, using tests that measure luteinizing hormone LH levels in urine, and monitoring changes in cervical mucus. Charting and tracking fertility signs can help breastfeeding mothers know when they are most likely to become pregnant if they are not using birth control. Additionally, some fertility awareness-based methods FATMs of birth control rely on monitoring fertility signs in order to determine the safest times for intercourse so that pregnancy is prevented. Tracking fertility patterns can also help breastfeeding mothers determine if the hormonal method of birth control they're using is working effectively. 5. Are there any natural birth control methods that are safe for breastfeeding mothers to use? Yes, there are natural birth control methods that breastfeeding mothers can use safely. These include abstinence, not engaging in sexual intercourse, fertility awareness-based methods such as the rhythm method, or tracking cervical mucus, and the lactational amenorrhea method LAM. The rhythm method is based on a woman's knowledge of her menstrual cycle and body signs. She must track when she ovulates, as well as have intercourse during non-fertile times. This method is not always reliable, as it can be difficult to accurately predict when ovulation will occur. The tracking cervical mucus method is similar to the rhythm method in that it involves tracking signs in the body to predict when ovulation will occur. The woman must track the amount and consistency of cervical mucus to determine fertility levels, as well as practice abstinence or use barrier methods during peak fertile times. The lactational amenorrhea method LAM is based on breastfeeding frequency, hormonal changes that occur with breastfeeding, and the amount of time since the baby was born. It is important to understand that not all women can use LAM, as there are certain criteria that must be met in order for it to be effective. Women who meet these criteria can trust this method to prevent pregnancy up to 98% of the time. 6. Are there any risks associated with using birth control while breastfeeding? Yes, using certain types of birth control while breastfeeding may pose some risks. For example, hormonal methods like pills, patches, or rings can decrease milk production in some women. It's important to talk to your doctor when selecting a birth control method so you understand any potential risks and side effects. Additionally, it's important to know that some birth control methods are not effective in preventing pregnancy while breastfeeding. For example, breastfeeding alone lactational amenorrhea method is only about 98 to 99% effective in preventing pregnancy and should not be relied upon as a primary form of contraception. Thanks for watching. We hope this video has helped you learn more about the best birth control options for breastfeeding moms. To learn more, be sure to subscribe to our channel and check out our other videos.